Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, not joined today by brother Stephen, but we've upgraded and we have Halie Cameron joining us today. Welcome back, Halie.
Thank you.
Now, did Stephen give you any notice today, or did he just say, "I'm out, you're in"?
I just found out.
Oh, great. Well, this will be you're learning right along with our listeners today. I don't have a catchy intro for you because I can't pick on you like I would Stephen, but we're going to be talking about cardiology today. Are you prepared for giving a deep dive into cardiology?
Sure, let's go for it.
Well, good. Well, we don't have to go too far, but if you can come up with some good questions. Today, we've brought in Dr. Rodriguez. Dr. Rodriguez is with Nashville Veterinary Specialist, and this is one of the sometimes doesn't happen a whole lot, but sometimes our veterinary team says, you know what? This case, your patient has needs that exceed my level of expertise, so we are going to refer you to a specialist. And Dr. Rodriguez is a specialist when it comes to cardiology. Dr. Rodriguez, thanks for joining us.
Thanks for having me.
Now, are you a podcast pro or is this your first one?
It's my first one.
Well, welcome. I think that's 2 episodes in a row. Our last guests were like, that was really easy. So today is just a conversation. We're not here to trick you or catch you in anything, but we're just really asking questions that curious pet parents at home would have. We'll start with an easy one. Maybe. I don't know. It's easy for me to say. But can you define the circulatory system and the role of the heart?
Yeah. So the circulatory system for dogs and cats, for our pets, is pretty much the same as is for people. And some people might not, even have an understanding of how it works in people. But basically, it's comprised of a network of vessels in the heart that provides blood flow to other organs in the body, all the tissues in the body, to provide oxygen and nutrients and hormones, and also to remove waste products. And the heart's kind of main role in all of that is it's the main pump. So it receives blood from the heart, from the body, goes into the right heart, and then the right heart pumps that blood to the lungs where it gets filled with oxygen. That oxygen-rich blood goes back to the left side of the heart, and then the left heart has to pump that blood out to the rest of the body.
Now, what is the difference between arteries and veins?
Yeah, so veins are you're receiving your deoxygenated blood, and arteries are going to be your oxygen-rich blood.
And the way I remember this is artery starts with A, and that's away
from the heart.
Away from the heart, artery. So the blood is going away. So do you call unoxygenated blood comes in through the veins and then through the right side, you said?
The right side of the
and then into the lungs where it receives oxygen, into the left side, and then away through the arteries.
Correct.
Okay. Did you learn anything yet?
Already.
Oh, there you go. All right. Great. Well, that is the full extent of my understanding of the circulatory system. Just about, I think. So I know there's some things in there about in the heart, there are valves. So tell us about valves in the heart.
Correct. So there's valves that separate all the heart chambers to make sure blood's flowing in the right direction through the heart. So there's basically 4 chambers, 2 top, 2 bottom, and there's valves that separate all those chambers. And then there's valves that separate the pumping chambers of the heart from the vessels that pump blood to the lungs and then pump blood out to the rest of the body. So their main function is to make sure blood's going in the right direction.
Why are there multiple chambers? Like, does each chamber do something differently?
Well, so the blood comes back into the top chamber, kind of the passive chamber, and then the valve opens and that blood goes down to the bottom chambers. The bottom chambers are the main pumping chambers of the heart. So they're the ones that have the thicker muscle, the stronger muscle to pump blood to the lungs and then again back to the left side of the heart. Okay.
So it's like you go from one waiting room to another and then another and then another. So it's not just always flowing. It goes in stages.
Correct. Yeah.
Okay. All right. So I know that in a pet exam, the veterinarians go, well, I'm going to listen to your heart. What are they listening for?
Yeah, a lot of things. So one, normally in dogs and cats, we just hear 2 heart sounds. So that's your typical, you think about lip bub, lip dub, like when you're listening to a heart. So they're listening to see if they hear extra heart sounds, which might mean one thing. Sometimes they hear what's called a heart, which is like a swishing sound. And then also the heart rate. Is it too fast? Is it too slow? Is it irregular, which we call arrhythmia? So those are the main things that they're listening to in regards to the heart itself.
How often, are murmurs and arrhythmias common? And how concerned should we be if our doctor says I hear a murmur, or I hear a faint murmur, or I hear an arrhythmia?
Yeah. I think in general, heart murmurs are very common, especially if you're in my job. That's all I do all day long is listen to heart
Right.
murmurs. It's uncommon I see something that doesn't have a heart murmur. But I think whether or not they can be concerned, it varies. So typically, if you hear a heart murmur, it's usually indicative of some kind of underlying disease, but not always. There are some animals that can have what we call innocent or benign murmurs. So like cats, for example, there are some reports that up to 50% of cat murmurs we hear are actually benign or normal. So it can indicate disease, but not always. And so some of the things to consider, if they hear a murmur, it really just needs to have a discussion with their veterinarian to try to determine if it is something that is concerning and needs further evaluation, or if it's something that they can monitor. And some things to consider are kind of where they hear the murmur, how loud it is, the breed and the signalment of the animal can help decide how concerning it is. So all those things need to be taken into account to determine how concerned they should be and if they need to do any other testing.
Are there any breeds that are more likely to have a heart murmur?
So there's breeds that are more predisposed to have heart disease. For example, Cavaliers. I don't know if they can see them.
Yeah, we can see that.
So Cavaliers, if you can see them too there, are probably one of the most common breeds we see with heart disease, and the heart disease they get results in a heart murmur. So it's very common that Cavaliers, as they get older, will develop a heart murmur.
Is there what if anything can our pet parents do to lessen the chances of heart disease in their pets?
Unfortunately, a lot of it comes down to genetics. So a lot of dogs are born with the genetics, or cats are born with the genetics to form or develop the disease. And so you can't eliminate that risk altogether, but making sure that things like making sure they're otherwise healthy, at an ideal body weight, that they receive a balanced diet. There are some links with some diets causing or affecting heart disease in pets. And it's not all cases, but definitely making sure that they're on a balanced diet that your primary veterinarian agrees with and approves of is important. And then just having regular routine visits with their vet and making sure they're otherwise healthy is the best thing they can do for the pet. But ultimately, a lot of these comes down to genetics.
So let's say that I take my cat to the vet, and the veterinarian, my general practice, listens to the heart, hears a murmur, and you said it could be that they say, well, let's just monitor it, or we're going to send you on, or they might try some treatments in it. What is kind of tell me a little bit about the route that we might go from when we've been diagnosed with the murmur. Like, when is it going to come to you?
Yeah, it varies. So I think if they hear a murmur, the definitive diagnosis of what's causing it is always going to be an echocardiogram and ultrasound of the heart. So that lets us see the heart chambers themselves, look at the blood flow through the heart, and determine what is causing that murmur. Or if the echo is normal, then we know the murmur is benign. So that's going to be the definitive way to diagnose that, but it is a more expensive test, so not everyone can do that test. So sometimes people want to do other tests first to kind of screen and see how severe it is. So things like chest x-rays, for example, can be done to look at the overall heart size. And so if it's a dog, maybe they do chest x-rays. If the heart size looks normal, it might be something they just want to monitor and hold off on doing the echocardiogram, again, depending on the breed and age of the dog. Cats are a little bit more tricky, but then there's also blood tests that can be done. So a common blood test that's done in cats is a biomarker called BNP. So if they have a murmur, they can do that test. It's kind of a screening test. And if it's abnormal, they may be more likely or more willing to go and do other tests. And if it's normal, they may want to wait and monitor. It's not perfect, so you can't have false positives and negatives both ends of it. So there's a chance you could miss a cat that has heart disease, or the BNP could come back abnormal and the cat's actually fine. But that's kind of the best you can do with a screening test.
You mentioned the term echocardiogram. What is that?
That's an ultrasound of the heart.
And what are you looking for every time my wife does an ultrasound of anything, it looks like a TV that needs to be hit on the side because the picture's out. Like, for those that remember rabbit ears, you probably don't.
I do.
Okay, good. So like, but with digital stuff, it's just either on or not. But anyway, I remember we hit the TV because it looked all staticky. But what are they looking for with the ultrasound or an echocardiogram?
Yeah, you're looking at the heart-specific anatomy. So all the heart chambers, if they're enlarged or size, how they're functioning. So especially the bottom pumping chambers of the heart, if they're pumping well. You can look at blood flow through the heart with color Doppler, so you can see if there's leaking of blood backwards across the valve. If there's any stenosis or narrowing of the valves, any congenital, if it's a young animal, any congenital defects or shunts that they're born with, is what we're looking at.
Is there for each chamber, like if I'm coming, is there one valve to bring blood into the top chamber and then another valve to go to the bottom, another to the lungs, and then another back into the lungs? And how many valves are we talking about?
There's 4 valves. So none to into the heart. So there's a valve that separates the top and bottom chamber on both sides. Tricuspid separates the right heart chambers, and the mitral separates the left heart chambers. And then there's a valve, the pulmonary valve, that separates the right ventricle to take blood to the lungs, and then the aortic valve that separates the left ventricle to pump blood out to the rest of the body.
There will be a test, Halie.
I'm gonna fail. It's all right though.
Hey, that's what we don't have to know. Exactly. We just have to know that Dr. Rodriguez knows.
Exactly.
Yes, right. So, are there just out of curiosity, is there one valve that's more likely to be leaky than others?
By far, especially in dogs, the mitral valve is the most common valve to have leaking.
Do you remember which one that was?
The mitral valve.
Which one? Like, where's that at?
Oh, no, I don't remember that.
I already forgot to. Do you draw pictures? We need pictures.
Yes.
So what? Is the most common, like, what are the most common defects of that mitral valve? Is it just not shut all the way?
Yeah, the most common thing is dogs get older, which I think my associate Dr. Owens, I think, is going to talk more about it. But as dogs get older, that mitral valve becomes thickened, and so it no longer closes fully, and that allows for some blood to leak backwards in the wrong direction through the heart.
It's like a toilet flapper.
Yeah.
It's not keeping the water in the bowl or in the tank. It's letting it go down to the bowl. And that's how my brain works. Okay. Well, let's see. Let's get back on the questions here that Stephen put together. We talked about that. This is a good one. Congestive heart failure. That's a term I've heard in people as well. What is congestive heart failure? What does that mean?
Yeah. I think a lot of people, a lot of terms get thrown around, so people get things mixed up. So there's heart disease and then heart failures and congestive heart failure. So heart failure is basically when the heart is no longer able to keep up with the demands of the body. And then the congestion is the end result of that. So when the heart can no longer do its job, eventually they can start to get fluid buildup in various organs, depending on which side of the heart fails. And when they have that active fluid buildup because the heart is not doing its job, that is congestive heart failure. So when they
is the fluid blood? Like, what's the correlation there?
So basically they get increased pressure in the vessels, and then kind of not blood, but just fluid leaks out from those vessels into different spaces. So if the left side of the heart fails in dogs, that typically causes fluid to build up on the inside of the lungs, so like in the airways. If the right side of the heart fails in dogs, that typically causes the fluid to leak out into their abdomen.
Okay.
In cats, they can get fluid either on the inside of the lungs or around the outside of the lungs with either left or right. And so it all is kind of species dependent where the fluid goes.
So I think about the circulatory system. I think about tubes going all through your body with little bubbles, the blood, like red blood cells floating around through there. But you're saying that what are those blood cells floating in? What is the fluid? What's it made of?
So it's made of like protein and other substances.
Okay, and so that's what's leaking out.
Correct.
But the blood cells don't usually leak out unless there's a major problem. Correct. Right? I guess. Okay, like a tear or something. Okay. All right. She's like, where are these questions coming from?
A lot of times when if they have fluid in their belly or around the outside of the lungs and we have to drain it, sometimes that's a treatment we do. Usually it's more of like a clear kind of straw colored fluid.
Okay.
A lot of these topics that we've been talking about, they use a lot of big, scary words and terminology that a lot of pet parents may not be familiar with, and it can sound really scary, especially to someone like me. I have 3 pets. If my doctor were to bring that up, that they're concerned about my pet's heart, that would definitely worry me. So can we talk a little bit about management of some of these conditions and how to help pet parents navigate a diagnosis like that?
Yeah. So, first thing is figuring out what disease. There's different diseases. So figuring out what disease it is will dictate what treatment. But most cases, it's going to be medically managed. So we're giving them medications to try to reduce their symptoms and improve their quality of life and slow down the disease progression for as long as we can. There are some things that are surgical, so like some congenital defects. So it's something that an animal is born with, sometimes can be fixed. And so those cases might be more of a surgical fix to eliminate the problem. And some older animals there are some surgeries that are an option as well. But I would say the vast majority of patients are going to be managed with medications. And so that's a lot of what I do is talking with owners, starting medications. It can be a lot. Sometimes they end up on multiple medications and kind of working through that as they get used to managing that. But the goal is, like I said, most cases is just to improve their quality of life and keep them around as long as we can.
So it's not, this is a bad term. It's not a death sentence necessarily. Like you can have a patient with a long-term heart disease that you can manage with medications and some husbandry issue.
Correct. Yeah.
Okay.
Again, it really depends on the disease. Some dogs can live with heart disease and cats many years.
Yeah. Okay.
So
well, I feel
hear it, but it's kind of like take it one step at a time,
That's right. There's not one single magic pill that fixes it all, though.
Correct. No, unfortunately.
Not yet. That's right. Okay. Well, what questions should we have asked you about the circulatory system and cardiology that we didn't?
I think the only thing I could add is I've touched on it with Cavaliers, but what breed predispositions there are. I think for pet owners, we see heart disease in any breed of dog or cat, but I think as a pet parent, knowing if you have a breed that is at high risk for heart disease just allows for them to be more educated, know what to look for, know what's coming down the road if their animal is diagnosed with a heart murmur, kind of know more about that. So I think that that's something, is just knowing the breed you own and what they're at risk for heart disease or other diseases.
And my dog Tadpole, which is the German Shorthair Pointer that is in our logo, and she lived to be 12, and she was diagnosed with a heart murmur maybe at year 8 or 9, and lived many years. And there's no way you can keep a German Shorthair Pointer from getting excited and getting the heart rate up, but she was definitely on medication for the rest of her life after that diagnosis. So it's not like, do often they require a lifestyle change?
Not usually. There are a few cases that we would, but part of that is also just dependent on each doctor what their preference is. Typically for me, I usually don't limit their activity or their excitement. If it brings the pet joy, then I think that it's worth letting them do those things. There are a few cases again where we might restrict their activity, but for most of the time they can still do their normal activities and be their normal happy self at home. That's our goal. That's
great. Well, that should give everybody some comfort too, I think. So, well, things that bring us joy, as every episode, we have something called our fun fact. Yep. And I hope Stephen told you about this. This is where he's not here, so we're just throwing everything on him. It's all his fault. This is something that you're going to share with our listeners at home that would help them win trivia or at least impress their friends and family at the upcoming summer barbecues. So, okay. Dr. Rodriguez, do you have a fun fact for us today?
I do. And since we're talking cardiology, did you know that octopuses have 3 separate hearts?
I did not know that.
They do. 2 to pump blood to their gills and then 1 to pump blood around their body.
They got a lot of tentacles to get, a lot of blood to get moving around. Have you ever worked on an octopus?
I have not.
Okay.
I did a lot of exotics in my residency, but octopus never made it my way.
What's the most interesting animal you've worked on cardiology with?
Probably tigers. I actually published normal echo values in tigers because we echoed enough of them in my residency.
That's cool.
Yeah.
Excellent. Well, very good. Well, Dr. Rodriguez, we really appreciate your time today and sharing a little bit about cardiology with our curious pet parents. I think next week we're going to have one of your associates, Dr. Owens, is going to be with us. We're going to take this one step further. I think you gave us a very good foundation for what we're going to be doing. And we appreciate you and your team being there for our patients when like I said, their needs exceed our level of expertise. So thank you for all you do, and keep up the great work.
Thanks for having me.
All right. Thank you, all you pet parents out there that are listening. Feel free to reach out to us if you have any questions or have a guest that you'd like to have that you would like us to have on. And until next time, stay curious.